The Indian Council of Medical Research has said that the country has not yet seen community transmission of the novel coronavirus outbreak. Director General of ICMR, Dr. Balram Bhargav, said India continues to be in stage 2, which is local transmission. He also said all 500 random samples have tested negative for novel coronavirus. He also informed that ICMR has decided to intensify testing facilities with expansion of network of its laboratories. He added ICMR is setting up 2 rapid testing laboratories at different places, which will have the capacity to test 1,400 samples per day, and it will become operational by the end of this week. Meanwhile, Health Minister Dr. Harsh Vardhan held a review meeting on containment and management of the novel coronavirus. He directed that teams be deputed to regularly inspect and monitor quarantine facilities for ensuring necessary amenities, to ensure that the necessary amenities are being provided. He also reviewed the preparedness of hospitals in terms of availability of testing kits, personnel, protective equipment, medicines, and isolation wards. He directed hospitals to ensure adequate availability of protective gear for all healthcare workers. India has evacuated 405 Indian nationals, including students, who were stranded at Kuala Lumpur Airport in Malaysia due to the coronavirus outbreak. The government has also approved Air Asia flights for Delhi and Vizag to help these students. In a written reply in Lok Sabha, the government informed that as many as 276 Indians have been infected with the coronavirus abroad, which include 255 in Iran, 12 in UAE, and 5 in Italy, and also 1 each in Hong Kong, Kuwait, Rwanda, and Sri Lanka. And according to the latest figures from the Union Health Ministry, the total number of confirmed COVID-19 cases in the country has risen to 151. Novel coronavirus has infected 134 persons in India, out of which 14 have been discharged after recovery and 3 of them have lost their lives. The Indian Army reported its first case of coronavirus after a 34-year-old soldier of Ladakh Scout Regiment tested positive, prompting the force to strengthen its check and prevention mechanism and suspend war games, conferences, and training activities. The Allahabad High Court has also issued an order declaring March 19 to 21st as holiday after a court employee was suspected to have contracted the novel coronavirus. The Bihar government has declared coronavirus as an epidemic. The move gives special powers to the government to deal with the situation. 311 suspected cases have been reported so far in the state, but none of them have tested positive, fortunately. Meanwhile, a day after banning the entry of foreign tourists to the Kashmir Valley, Jammu and Kashmir administration has also suspended the Vaishno Devi pilgrimage and all interstate bus services to the Union Territory in a bid to stem the spread of coronavirus. Rajya Sabha Chairman M. Venkaiah Naidu on Wednesday informed members about the several preventive measures that have been taken in Parliament complex in the wake of coronavirus spread. The chairman said the Parliament House complex has been sanitized and temperature checking is being done at the gates before allowing anyone inside the premises. Also, hand sanitizers have been kept at various points. The chairman urged members to give constructive suggestions as well to augment the safety measures.
We have sanitized the entire parliamentary complex, just for information. Second, these hand sanitizers have been kept at various places. Third, time to time, all the necessary arrangements also will be made. If, in addition to this, if members have any suggestions, they can convey to the Secretariat or they can convey to the Chairman about the need to take some more steps as far as the sanitation and the required measures are concerned. I leave it to the members.
As the Congress members demanded curtailment of Parliament session, Union Minister Mukhtar Abbas Naqvi said that MPs must set an example by functioning the House.
The temperature checking is being done at the boom barrier. As a result, there's a huge traffic jam. There are 3-4 people in every vehicle, and there are half a kilometer long queues there. It took me 15 minutes to cross the boom barrier. It should be done at the entry gate. It does not make any elementary sense.
I take note of your point.
And also, what the honourable member has said, I fully associate. We are telling the entire country for social distancing, and if we do not do it here, it does not make
right.
आज 130 करोड़ हिंदुस्तान के लोगों में एक जुनून भी है, जज्बा भी है कि इस वायरस से लड़ना है। अगर हम इस सदन के अंदर बैठ करके हमारा मिजाज जो है इसमें लड़ने का, इस जुनून और जज्बा नहीं दिखेगा और हम उसमें पैनिक करेंगे तो निश्चित तौर से वो देश के हित में नहीं है।
Several important issues of public importance were raised during Zero Hour in Rajya Sabha on Wednesday. Issues raised include the rising cases of kidney failure, crude prices, and also impact on fuel prices in India. Ripun Bora of the Congress and Sanjay Singh of the Aam Aadmi Party also raised issues related to COVID-19. Let's listen in.
कोरोना वायरस के परीक्षण के लिए दिल्ली और भारत भर में परीक्षण केंद्रों की भारी मांग है। यह वायरस दुनिया भर में फैल गया है और भारत की भारी आबादी को इस संक्रमण का खतरा है। हमें दक्षिण कोरिया जैसे अन्य देशों से परीक्षण मॉडल को अपनाना होगा, जो ड्राइविंग इन परीक्षण केंद्रों की तैनाती कर रहे हैं। सरकार को एक वास्तविक समय पोर्टल बनाना चाहिए और इसे कुल राज्यवार सकारात्मक कोविड-19 मामलों के साथ अद्यतन रखना चाहिए।
In the entire country, not to speak of only in metropolitan cities, even in the remote areas also, there is acute scarcity of soap and acute scarcity of masks and sanitizers, and some unscrupulous sellers, they have taken the advantage of this, taking exorbitant rate from the public. So now my suggestion to the government, and more particularly to the Ministry of Health, to closely monitor the situation in the entire country so that sufficient stock is maintained.
पटना में जो एम्स खोला गया है महोदय, उसमें सही व्यवस्था नहीं रहने के कारण लोग जो है दिल्ली एम्स में आकर के अपना इलाज कराते हैं और परिवार एवं कल्याण जो स्टैंडिंग कमेटी है उन्होंने अपनी रिपोर्ट 2018 में जो पेश की थी उसमें बहुत सारी कमियों को उन्होंने उजागर किया था और उसकी व्यवस्था को सुदृढ़ करने के लिए कहा गया था, लेकिन अभी तक वहां की व्यवस्था सुदृढ़ नहीं हो पाई है। मैं आपके माध्यम से अनुरोध करना चाहती हूं कि वहां जो कमियां हैं उस कमियों को पूरा किया जाए।
In the Lok Sabha too, members of parliament raised the issue of coronavirus during Zero Hour.
कोविड-19 का प्रकोप बुरी तरह से है, जिसमें 140 से ज़्यादा देश जहां प्रभावित हैं, वहीं 2 लाख के लगभग संदिग्ध मरीजों की संख्या है और 7,500 से ज़्यादा लोगों की मृत्यु इसमें हो चुकी है। लेकिन हमारे देश में जहां एक बड़ी जनसंख्या है 130 करोड़ की, हमारी सरकार ने इस पर नियंत्रण रखा है और अभी तक केवल 140 के लगभग हमारे यहाँ संदिग्ध लोग मिले हैं और केवल 3 इंजरी हमारी जो कैजुअलिटी हुई है। लेकिन अभी जो ये बीमारी है इसके अभी बढ़ने के आसार है, इसलिए नियंत्रण के लिए और भी सावधानी की आवश्यकता है।
Through you, sir, regarding the Indian students studying in Philippines and other countries. Sir, Government of India has banned the entry of passengers from Philippines and Malaysia as a precautionary measure to prevent the spread of the coronavirus. Yesterday, around 200 Indian students studying in Philippines were stranded in Malaysia en route to India. Thanking the Ministry for initiating necessary steps to bring them back to the India safely.
I am seeking a response from the government This is a very important issue. So hundreds of students and Indians are stranded in various countries. Italy, Iran, Malaysia, Philippines. So I urge upon the government, kindly respond to this issue because they have no idea how to go, how to move. All are stranded in the airports and there is no other way. Only the mission of India has to intervene and the government of India and especially the External Affairs Ministry has to intervene into this matter and send special aircrafts. So my suggestion is send special aircraft so as to evacuate all these people who are stranded in Manila, in Rome, Kuala Lumpur and also in Iran.
The World Health Organization has called for aggressive action in Southeast Asia to combat the fast-spreading coronavirus, warning that some countries were heading towards community transmission of the deadly disease. Infections have soared across the region in recent weeks, forcing several countries to introduce drastic measures, ranging from closing their borders to foreign arrivals and also imposing nighttime curfews to closing schools and cancelling sports events. The World Bank has also announced increasing to $14 billion the amount of fast-track financing to assist companies and countries in their efforts to respond to the rapid spread of COVID-19, adding $2 billion to the initial package. The announcement came amid fear of a major global recession in the wake of the coronavirus that has impacted more than 120 countries. COVID-19 cases surpassed 2 lakh worldwide on Wednesday as the new coronavirus continues to spread outside of China, the original epicenter of the outbreak. Coronavirus deaths in Europe have exceeded the toll in Asia for the first time. Europe counted at least 3,421 deaths compared with 3,384 for Asia, where China was the initial epicenter of the pandemic, which has now infected more than 1,94,000 people globally and killed 7,873. Italy has the most number of fatalities in Europe with 2,503. Iran reported its single biggest jump in deaths from the novel coronavirus on Wednesday as another 147 people died, raising the country's overall death toll to 1,135. The nearly 15% spike in deaths amid a total of 17,361 confirmed cases in Iran marks the biggest 24-hour rise in fatalities since officials first acknowledged cases of the virus in Iran in mid-February. The deadly coronavirus has hit all 50 states in the United States of America as West Virginia reported its first case of the infection on Tuesday. In fact, BBC reported that New York City is considering a lockdown similar to the one in the San Francisco Bay Area. There have been 108 deaths in the US so far and more than 6,300 confirmed cases in the country. In fact, as we speak, globally, there are about 2 lakh cases and nearly 8,000 people have died because of novel coronavirus.